Resting heart rate is the number of heartbeats per minute when a person is at complete rest. It's usually measured in beats per minute, or BPM. The average resting heart rate for adults ranges from 60 to 100 BPM. There are many factors that affect your resting heart rate, such as age, gender, fitness level, and body size. However, there are also some other factors that can affect it as well. One factor being stress levels, which can cause your heart to beat faster than normal even when you are not doing anything physical to exert yourself. Another factor that affects your resting heart rate is your health status and how healthy you are overall. If you have a chronic condition or illness like hypertension or diabetes, your resting heart rate will be higher than someone who is in better health. The biggest factor that affects your resting heart rate is age. One of these factors is that when you get older, your body typically produces less of the hormones and chemicals responsible for the fight or flight response. This means that when you're older, your body's resistance to stress and danger often declines, which could affect your resting heart rate. A higher heart rate in an older individual is typically a sign of health issues. The heart's ventricles, which pump blood out of the heart, start to dilate because they are not receiving enough oxygen. As a result of the too much blood flowing through the body and not enough oxygen, your heart starts to beat faster. Athletes and biohackers often have a lower resting heart rate than the average person. This is due to the years of training, discipline, and a healthy lifestyle that they lead. The heart is an organ of movement and strength, and like any muscle, it must be exercised in order to function properly. When an athlete trains at high intensities, his heart rate typically increases due to the increased demand of oxygen delivery to the muscles, which helps to improve performance. When exercising, it is important to monitor your heart rate because if it becomes too high or too low, this may indicate a risk of injury. We would like to hear about your own experience with this topic. Leave a comment. Lastly, remember that it is important to talk to your doctor or other professional before beginning any sort of supplementation or treatment. Feel free to contact us if you want us to give you the contact information of professionals who work with our network.